Well, good afternoon, everyone. I think it's important to start today by addressing the situation we are facing at the national level. There are a number of hardworking individuals from federal agencies who are working tirelessly with our team to get us the information and resources that we need. But leadership from the top has been lacking. We are still waiting for congressional action on federal aid, particularly on the request from 303 bipartisan mayors across the nation for $250 billion in direct aid to cities like Philadelphia. What's worse, if it can be worse, yesterday the President said he is prepared to open up our country again, ignoring the clear evidence that our city and many others are seeing on the ground. He claims he will not allow the cure to be worse than the problem. He is insinuating that economic loss and change of lifestyle are more damaging than the deaths of countless Americans. This is clearly unacceptable. I want to be clear. Philadelphia will continue to do what is best for our residents. We recognize that our stay-at-home order will create serious disruptions and economic hardships for tens of thousands of people. But our health department and other experts are absolutely certain that ignoring the restrictions we have imposed will further spread the virus. To lift restrictions this time is the ultimate example of short-sightedness. While doing so may help some businesses stay afloat, the cost in lives and the cost to society will be far greater. At this time, Dr. Farley and his team have no indication that the spread of COVID-19 is letting up in Philadelphia. We will continue to follow their direction as we attempt to slow the spread and keep our people healthy. It is clear that states and cities across the country have been stepping up throughout this crisis, as they've had to do repeatedly over the last 3 years, and that we will need to continue to do with such a clear lack of leadership in Washington. So let's be clear. Our stay-at-home order is still very much in place, despite what you heard yesterday from the White House. It's still very much in place and will continue to be. Residents and business owners can visit phila.gov/COVID-19 to learn more about what is and is not allowed under this order. We also have a list of resources for businesses and workers on the site, and I encourage everyone to take a look at it. And we will continue to work with legislators at the state and federal levels to identify additional resources as they become available. Now I'd like to welcome Dr. Farley to the podium to provide an update from our Department of Public Health.
Good afternoon. I'm going to give you an update on the spread of the coronavirus in Philadelphia and some other health-related issues. Since 1 p.m. yesterday, we have had 77 new cases of the coronavirus infection reported in Philadelphia residents, bringing us to a total of 252 cases since the beginning of the epidemic. More details on that number. 10 of those were, of the 252, 10 were under the age of 20, 122 were between the ages of 20 and 39, 56 were ages 40 to 59, and 64 were above the age of 60. Now, our daily number is a little bit less than it was yesterday, but still the overall trend is increasing rapidly, and we expect that to continue to do so for at least the next week or so. Of the 252, 23 are known to be hospitalized. Among our hospitalized people, 1 are under the age of 20, 5 between the ages of 20 and 39, 8 between the ages of 40 and 59, and 9 above the age of 60. So if you notice with those statistics, the people with this infection tended to be young adults, but the people who are hospitalized tended to be older adults. That's a pattern that we saw in other countries than we expected here. Of those with the infection, 25 are known to be healthcare workers. We know healthcare workers are the group that's the greatest risk for this infection. Now a little bit about testing. Testing is available through most hospitals and other large healthcare providers in the city, but it is limited because of the availability of test kits and because of laboratory testing capacity. Each of these healthcare providers has their own criteria for who they are going to test, and it's available by referral from those healthcare providers. In general, we are recommending testing for people who have symptoms, not for people who do not have symptoms, but people who have symptoms and are either healthcare workers or are above the age of 50. Many people have asked questions about whether they should be tested, and if so, how they would get tested. So we have posted guidance on our website, phila.gov/COVID, to help people understand whether testing is appropriate for them, and if so, how to get it. And it provides links and phone numbers for people who are trying to get the test. Now, that guidance is something that we will change probably frequently, because as the situation evolves, our testing criteria will change too. We do have a testing site in Citizens Bank Park. Yesterday we tested about 80 people. That was limited by the bad weather. It was difficult for our team to do the work down there. The site will be open today from 1 to 6 p.m. The weather is expected to be bad again tomorrow, and so our team will not be out there tomorrow. We're going to cancel tomorrow, but we will be out there from 1 to 6 p.m. this afternoon, and we expect to be open the day after tomorrow. Now, with the number of positive tests increasing, there are increasingly situations where an employer finds out about an employee who tested positive. So we do have guidance on our websites. It's listed as guidance for essential businesses that give employers and others that work in a workplace setting information about how to handle it when an employee does test positive. Then just general advice on what to do and how you can keep safe. As we said before, but we need to keep repeating, stay home, except for maybe when you're going out for a walk or a run or a bike ride, and when you're going to do that by yourself or only with family members, then come back, keep your distance from people, and wash your hands. Now, and I was asked in view of the President's comments yesterday, really about the value of social distancing and the stay-at-home order from a health perspective. So if I could, I want to back up a few steps and kind of give people the reasoning for this from the beginning. This infection could infect any of us. For most people, the infection will be mild or moderate, and they will recover. But the disease can be serious, and it can be fatal. It can be fatal for anyone at any age. We know that there's no cure for this infection, and that there's no vaccine for this infection right now. So the best thing we can do is try to prevent people from becoming infected in the first place through the actions we take place every day. We know that there are limits on who we can test. So there are many people that the health department doesn't know that have the infection because we haven't tested them. It's not even close. In fact, we know that most people with this infection in the city of Philadelphia right now, we are unaware of. That means that anyone you come in contact with could have this infection, anyone. So you have to assume that everyone that you are coming in contact with has the infection and try to protect yourself based upon that. You don't want to catch this infection, and you don't want to spread this infection to your loved ones. The way it's spread is through close contact. By close, I mean within 6 feet. How does that happen? It happens when a sick person coughs or sneezes or even talks and puts out very small droplets in the air. We all do that all the time. But if a sick person does that, those droplets can carry the infection with them. And someone within a few feet can then come in contact with those droplets and get the infection through that. So that can be prevented by people staying physically apart, apart 6 feet or more. That will reduce or even stop the spread. Now, if everybody follows our recommendation 100% of the time, so no one is ever within 6 feet of another person, this epidemic stops in just a few weeks. Now, we know that'll never happen. We're never going to get everybody to do this 100% of the time. But if most people, even if not all, but if most people follow these recommendations, it'll slow the epidemic wave. That'll buy us time. That'll buy us extremely valuable time. That's time for scientists to develop a treatment, or scientists to develop a vaccine, or just to slow the epidemic wave so that those healthcare facilities which are there to treat us are available when we do get sick. People have asked, how long do we need to do this? If everybody does this, how long before this epidemic starts to slow or starts to decline? Well, it's really very hard to predict. I don't think anyone knows. I can say this, though, based on the experience of other countries, if we do this right, that maybe within 2 to 4 weeks we can see evidence of slowing of the epidemic wave. So what I've seen is that most people are following our recommendations, even though it's inconvenient. So I want to thank everyone that's doing that. It's not easy. It's difficult. Social distancing is difficult. Not knowing the future is difficult. It's tough on all of us. But we've been through tough times before. And as a nation and city, we've been able to get through this other times. We can get through this one as well. So we can do this. So again, I want to give a big thanks to everyone who is following our recommendations, and they're doing their part to protect everyone else. If you want more information, again, reminder, all the information is at www.phila.gov/COVID, or if you have medical questions, call 1-800-722-7112. Now I want to turn it over to Azucena Ugarte, who's going to talk a little bit about this in Spanish, as well as provide other information.
Buenas tardes, yo soy Azucena Ugarte, soy la directora de la Oficina de Estrategias contra la Violencia Doméstica y voy a hacer primero el anuncio que Dr. Farley ha hecho ahora. Última información sobre el COVID-19 en Filadelfia. Desde ayer a 1 de la tarde se han confirmado 77 nuevos casos de coronavirus en Filadelfia. Actualmente tenemos un total de 252 casos confirmados. La tendencia es que los casos sigan aumentando rápidamente. Los detalles que podemos proporcionar sobre el contagio son los siguientes. 10 personas menores de 20 años, 122 personas entre los 20 y 39 años de edad, 56 personas entre los 40 y 59 años, 64 personas mayores de 60 años, 130 hombres, 120 mujeres. No se tiene información sobre el género de las 2 personas restantes. Tenemos 23 hospitalizados, una persona menor de 20 años, 5 personas entre los 20 y los 39 años, 8 personas entre 40 y 59 años, 9 mayores de 60 años. Esto significa que hay casos en todos los rangos de edad, incluidas personas jóvenes. Las personas mayores son las que tienen más probabilidades de ser hospitalizadas. 25 casos son de trabajadores de salud. Los resultados de las pruebas del coronavirus que estamos haciendo en la ciudad pueden ser encontrados en la página web https://www.fila.gov/covid. Luego haga clic en What the City is Doing y podrá encontrar todos los resultados ahí. Es importante recordar que si bien los números diarios pueden subir o bajar, lo que nos interesa es la tendencia general y estamos viendo que aumentan. Sobre las pruebas. Las pruebas están disponibles en la mayoría de los hospitales, pero con limitaciones. Estas limitaciones están relacionadas a los kits de pruebas y a la capacidad de laboratorio. Cada hospital tiene criterios de elegibilidad específicos, por lo que es importante llamar con anticipación. En general, la mayoría de las pruebas son para personas que tienen síntomas, para trabajadores de la salud o para personas que son mayores de 50 años. Hemos publicado orientación sobre quién debe hacerse la prueba del coronavirus en el sitio web COVID de la ciudad. Esta información se encontrará disponible en español. Sobre el centro de pruebas en el Citizen Bank Park. Ayer se realizaron 80 pruebas, pero tuvimos que cerrar temprano debido al clima. Hoy está abierto de 1 a las 6 de la tarde. Es necesario que se haga cita. No es necesario que se haga cita, pero se aplicará la prueba a personas que tienen síntomas, que sean trabajadores de salud o que tengan más de 50 años. El centro de pruebas estará cerrado mañana debido a que se espera mal tiempo. Hemos recibido muchas preguntas sobre qué deben hacer las personas si algún empleado da positivo del COVID-19. Tenemos orientación sobre eso disponible en la página web de la ciudad. Hay cosas que usted puede hacer desde su hogar para mantenerse a salvo. Primeramente, y lo más importante, es quedarse en casa. Si tiene que salir por alguna emergencia, mantenga la distancia social y lávese las manos con frecuencia. ¿Por qué es importante todo lo que estamos haciendo? La mayoría de las personas que contraen esta enfermedad tienen síntomas leves o moderados y se recuperarán bien por sí solos, pero la enfermedad puede ser grave y mortal. Debido a que no hay cura, lo mejor que podemos hacer es tratar de evitar que se propague a otras personas. Desafortunadamente, debido a que hay límites en la cantidad de personas que podemos evaluar, no podemos identificar todos y cada caso. Es importante darse cuenta de que cualquier persona puede tener la infección y es posible que aún no lo sepa. Por ello, Nuestras recomendaciones son tan importantes para que todos en Filadelfia las sigan todo el tiempo. Usted no quiere contraer y tampoco quiere propagar esta enfermedad. El coronavirus se propaga más fácilmente por contacto cercano, es decir, cuando estamos a menos de 6 pies de distancia. Cuando alguien está enfermo y tose, estornuda o habla, puede infectar a alguien cercano. La mejor manera de reducir o detener la propagación de enfermedades como esta es mantener la distancia social o quedarse en casa. Si todos seguimos estas recomendaciones al 100%, esta epidemia se detiene en pocas semanas. Si la mayoría, pero no todos, siguen estas recomendaciones, se podrá parar esta epidemia. Eso es importante, porque nos da tiempo para que los científicos desarrollen tratamientos o vacunas. Con una ola más lenta, los hospitales pueden tratar a todos los que necesitan atención. ¿Cuánto tiempo tomará saber si esto funciona, si nuestras recomendaciones están funcionando? Es muy difícil de predecir. Según lo que estamos viendo en otros países, podríamos ver si está funcionando en 2 o 4 semanas. Sabemos que la mayoría de las personas siguen nuestras recomendaciones o nuestra guía, aunque sean difíciles. Les agradecemos su apoyo. Sabemos que es difícil. Mantener distancia social es difícil. No saber lo que traerá el futuro es difícil. En esta nación y en esta ciudad hemos pasado por tiempos difíciles antes. Esto lo podemos superar. De nuevo, muchas gracias a todos los que están haciendo su parte para proteger a todos nosotros. No olviden consultar el sitio web para mayor información, www.fila.gov/COVID. Si usted tiene preguntas médicas, puede llamar las 24 horas del día, 7 días de la semana, de forma gratuita al 1-800-722-7112. Voy a repetir el número, es 1-800-722-7112. Gracias.
Good afternoon. I'm Eva Gladstein, Deputy Managing Director for Health and Human Services for the city. I wanted to share some updates from our cabinet. During these times of uncertainty, we are focused on supporting those among us who are most vulnerable. You hear every day from Dr. Farley and his work and that of his tremendous staff at the Public Health Department. And this past Sunday, we received updates from Homeless Services, Behavioral Health, and Intellectual Disability Services. Today, I'm going to focus on our work to support the basic needs of individuals. First, we are aware of news reports about our development of a quarantine site. The site is still in development and is not currently operating. And to be clear, it will be for anyone who cannot quarantine at home, not just for those who are experiencing homelessness. To protect the privacy of those who might need quarantine, we will not be giving out any more details nor divulging the location. To move on, I wanted to focus on access to benefits, which are crucial during this time. Benephilly, which is a partnership between the city and Benefits Data Trust, is open for business through their call center. This service can help you screen and apply for up to 19 public benefits from federal, state, and local government that you may be eligible for. Their phone number is 844-848-4376. And I will repeat that, 844-848-4376. We know that many people are now in the situation of having to apply to the state for unemployment benefits, and the state is inundated with those applications. Unfortunately, Benephilly cannot assist with unemployment compensation. Our partners at Community Legal Services are offering a few tips for helping ease that application. Firstly, they advise that you should try to apply online if that is available to you, and to use a computer rather than a cell phone if possible. They also want to make sure you're aware that if your place of work closed due to COVID-19 and no work is available, that you select the lack of work reason on the application. This should apply to the majority of workers. Everyone who applies will get a financial determination about the amount of their benefit, but they will still need a final decision beyond that. That final decision might not be communicated to you directly, and so what we do is advise you to check in your bank account because the money would just be deposited there, possibly without notice to you. Clearly, many of us will need financial counseling through this time and afterwards, and we wanted you to be aware that the city partners with Clarify to provide free one-on-one financial counseling that can help you develop a plan, talk to lenders, landlords, credit card companies, and find additional resources. Their number is 1-855-346-7445, and I'll repeat that, 1-855-346-7445, and you'll be able to schedule an appointment over the telephone. We've also seen that many of our nonprofit and faith-based organizations are continuing to provide meals to those who are food insecure. They've had to move this meal service from indoors to outdoors to ensure safety, and we have been providing them with guidance to make sure they have the proper permits, that they're practicing social distancing, that they're providing food as grab and go rather than as a prepared meal, and that they're ensuring that staff, volunteers, and meal participants have the appropriate safety materials such as gloves, hand sanitizer, and hand washing facilities. For more information on this, you can email ohs-generalinfo@phila.gov. And again, that's ohs-generalinfo@phila.gov. I also wanted to provide a reminder that evictions are prohibited during this period. It is never legal to evict a tenant without a court order, and Philadelphia courts are closed through April 3rd, and no legal evictions will proceed until they reopen. If your landlord changes your locks, bars your door, cuts off your utilities, removes your possessions, or otherwise forces you out of your home, they are breaking the law. You can call 911 and report an illegal self-help eviction to the police, or you can call the tenant hotline at 267-443-5200, and they can assist you. I'll repeat that number. It's 267-443-2500. They could also, or other attorneys could assist you with filing an emergency petition with the Court of Common Pleas. We were giving Azucena a short break. She's going to come back up and speak about how to stay safe in the case of domestic violence. Thank you.
Good afternoon again. My name is Azucena Ugarte, and I'm the Director of the Office of Domestic Violence Strategies. In this time of uncertainty, victims and survivors of domestic violence may find themselves at higher risk of being hurt. The stay-at-home order, along with the possibility of job loss, could cause further stress in some already difficult domestic situations. I'm here to remind you that you are not alone. There are service providers and advocates working tirelessly to make sure services are open for you. If you want to file a protection from abuse order or PFA, now you have the option to do it by email or by phone from Monday to Friday from 8 a.m. to 4 p.m. You can email a pre-prepared order to temppfa@courts.phila.gov. That is capital T, EMP, capital P, capital F, capital A, @courts.phila.gov. You can find the PFA form at the court's website that will be included in the press release to be issued shortly by the mayor's office. If you prefer to file a PFA order by phone, you would have to call the domestic violence unit at court between 8:30 in the morning at 11 a.m. The number is 215-686-6311, extension 19217. Once again, that's only between 8:30 in the morning and 11 in the morning, and the number is 215-686-6311, extension 19217. If you need to file for a protection from abuse order after business hours, that means after 4 p.m. and before 8 a.m. of the next business day, you can file, including weekends, you can file an order at the emergency filing unit in room B03 at the Stout Center at 13th Street and Filbert Streets. That is B as the basement, 03 at the Stout Center. If you would like to talk to someone about your legal options, or if you need legal advice related to domestic violence, you can call the Women Against Abuse Legal Center during business hours. The number is 215-686-7082. You would have to leave a message and a safe number for an advocate to call you back. If you want to talk to a domestic violence advocate about your situation, your options, and planning for your safety and the safety of your children, you can call the Philadelphia Domestic Violence Hotline at 1-866-723-3014. This line is open 24 hours a day, 7 days a week, and they use language line to interpret to any language. If you're an immigrant survivor or victim of domestic violence and would like to talk to an advocate about what specific protections are available for you, there are different organizations. You can call Nationality Service Center at 215-893-8400, extension 1532. That's Nationality Service Center, 215-893-8400, extension 1532. If you are an African and Caribbean immigrant or refugee, you can contact AFAJO by sending an email to Caitlin, that is CAITLIN, at afajo.org. For the Southeast Asian communities, you can contact CIMAC by calling 215-467-0690. Also, there is HIAS Pennsylvania. The number for HIAS is 215-832-0900. If you are in need of services for human trafficking victims, you can call Nationality Service Center at the same number, 215-893-8400, extension 1575, or the Salvation Army New Days Hotline, 267-838-5866. I would like to take this opportunity to recognize our community partners, Congreso de Latinos Unidos, Lutheran Settlement House, Women Against Abuse, Women in Transition, Salvation Army's Anti-Trafficking Program, Nationality Service Center, CIMAC, AFAJO, HIAS Pennsylvania, and others. Thank you for all the work you do to make sure that Philadelphia residents and families are safer. And again, to those facing the possibility of domestic violence, I repeat, you are not alone. Now, I would like to repeat this information in Spanish. Buenas tardes. Yo soy Azucena Ugarte, la directora de la Oficina de Estrategias contra la Violencia de Pareja. Estos tiempos de incertidumbre hacen que las víctimas de la violencia de pareja se encuentren en más riesgo de ser lastimadas. La orden de quedarse en casa, junto con la posibilidad de perder empleo, puede causar más tensión en situaciones domésticas que ya son bastante difíciles. A pesar de eso, quisiera recordarles que ustedes no están solas ni solos. Tenemos en Filadelfia a un grupo de organizaciones que trabajan incansablemente para asegurarse de que ustedes tengan acceso a servicios. Si usted necesita una orden de protección contra el abuso, que en inglés se llama PFA o PFA, ahora usted la puede pedir por teléfono o por correo electrónico de lunes a viernes de 8 de la mañana a 4 de la tarde. Para pedir la orden por correo electrónico, usted tiene que mandar la orden ya preparada a la siguiente dirección: temp.pfa@courts.fila.gov. Eso es T mayúscula, EMP, P mayúscula, F mayúscula, A mayúscula, @ courts.fila.gov. El formulario que necesita para preparar la orden lo puede encontrar en la página de Internet que será publicada con este anuncio. Si usted prefiere pedir la orden por teléfono, debe llamar entre las 8:30 y las 11 de la mañana al 215-686-6311, extensión 19217. Este es el número de la Unidad de Violencia Doméstica del Juzgado Civil. Si usted necesita una orden fuera de los horarios de oficina, es decir, después de las 4 de la tarde y antes de las 8 de la mañana del siguiente día útil, incluidos los fines de semana, entonces debe ir al Centro Stout, también conocido como el CJC, y tiene que ir al cuarto B03 en el sótano. Si usted prefiere hablar con alguien sobre sus opciones legales o si necesita consejo legal relacionado con la violencia doméstica, usted puede llamar al Centro Legal de Women Against Abuse. El número es 215-686-7082. Cuando llame, deje su mensaje y un número de teléfono al que se le puede devolver la llamada sin peligro. Si usted quiere hablar con alguien sobre su situación, sus opciones y cómo planear para la seguridad de sus hijos y de sus hijas, puede llamar a la línea de ayuda contra la violencia doméstica en Filadelfia. El número es 1-866-723-3014. Esta línea opera de las 24 horas del día, todos los días, y usa un sistema de interpretación para todos los idiomas. Si usted es un inmigrante que desea saber más sobre sus derechos y opciones, puede llamar a Nationality Service Center al 215-893-8400, extensión 1532. Para inmigrantes o refugiados del Caribe o de África, usted puede contactar a FAJO, mandando un correo electrónico a esta dirección. Caitlin, es CAITLIN, @afaho.org. Para inmigrantes de comunidades surasiáticas, usted puede contactar CIMAC llamando al 215-467-0690. O también puede contactar, en el caso de cualquier inmigrante, a Hayes, Pensilvania, al 215-832-09900. Si usted necesita servicios contra el tráfico humano, puede llamar a Nationality Service Center al mismo número, 215-893-8400, extensión 1575, o a la línea de ayuda del Nuevo Día del Salvation Army, 267-838-5866. Yo quiero aprovechar esta oportunidad para reconocer a las organizaciones comunitarias que proveen todos estos servicios. Congreso de Latinos Unidos, Lutheran Settlement House, Women Against Abuse, Women in Transition, Salvation Army's Anti-Trafficking Program, Nationality Service Center, CIMAC, AFAJO, Hayes, Pensilvania. Gracias por el arduo trabajo que sus empleados y empleadas hacen cada día para asegurarse que los residentes de Filadelfia estén más seguros. Y nuevamente, para ustedes que están viviendo la violencia de pareja a diario, quiero repetir que no están solos. Thank you. Muchas gracias.
Good afternoon. Azucena will be back to answer Spanish language questions at the end of the question and answer period, and we're happy to take your questions.
Okay, we'll now move to our Q&A portion for members of the media. So if you are logged in, please use the raise your hand feature, which is under participants. We will unmute you one by one to ask your questions. We do ask that you keep it to 3 questions or less, and we will go back around for a second time. But right now, I believe we have about 6 or 7 in the queue. Okay, first we're going to go to Michelle Zipkin with the Philadelphia Gay News. You are unmuted.
Yes, hello. This question may have been answered in so many words, but what is being done for LGBTQ communities at this time, specifically those who are experiencing homelessness or have limited access to health care?
We are doing everything we can to provide access to health care and services to all of our homeless population, no matter what gender or sexual orientation. These are challenging times for all of our communities, and we are certainly focused on providing whatever resources we can to those who are less fortunate and our most vulnerable residents.
Thank you.
Okay, next we have Pat Loeb with KYW.
I have two questions, Kelly. One's for Dr. Farley. We're returning today. We've talked to a couple doctors about the loss of sense of smell and taste. Yesterday, you said that was not something the city was looking at, but I wondered if you've begun to look at that.
We don't collect that information about the symptoms of people who have this infection, so we can't say how frequently that occurs. I can say that a loss of smell is something that's not uncommon with various illnesses, and so I would not consider it to be specific enough to be valuable in anybody deciding whether someone is likely to have this infection or not.
Okay, thank you. And my other question is for Brian. How are negotiations going to perhaps find new bed space at the shutdown Hahnemann Hospital?
The conversations with Hahnemann have been, I'll say, challenging. I think they started off with a very strong desire for us to purchase the building. We clearly aren't in a position to purchase the building. They've come back with a year-long lease, which we have to also turn down. They've now at least brought it down to a 6-month lease, which is a little bit more reasonable, although their rental price is not. We're continuing to try and negotiate and find a path forward, but as you know, the owner, Mr. Friedman, was difficult to work with at times when he was the owner of the hospital, and he is still difficult to work with as the owner of the shuttered hospital. I hope that this space is necessary for us to continue to build out surge space and additional quarantine and isolation space, and I'm cautiously optimistic that we'll find a path forward, but and hope that the owners will be more reasonable in future negotiations.
As a follow-up, do you feel like he is risking the public health with his, let's say, not negotiating in good faith?
I think he is looking at how to turn an asset that is earning no revenue into an asset that earns some revenue and isn't actually particularly thinking through what the impacts are on the public health. I think he is looking at this as a business transaction rather than providing imminent and important aid to the city and our residents.
Thank you.
Okay, now we are going to go to Jeff Cole with Fox 29.
Yeah, good afternoon. Have a question first, 3 questions if I could. First for Dr. Farley. Dr. Farley, can you give us more specific information on how the limited PPE and the delay in testing results, just the period of time to get the results, is impacting your ability to test in the city? You raised it yesterday. I'm wondering if you can provide us more specific information today on that.
Yeah, so there's limits on a number of things which have limited our ability to test people. We have a limit on the personal protective equipment, which we want to preserve first for healthcare workers who are exposed to patients in hospitals. We have a limit on the swabs that we use to collect the sample, and we have a limit on what the laboratories can do or how many tests the laboratories can do. Because of that, we've had to have narrow criteria for who we can test. That means that there are people out there who have the infection who we don't diagnose. We know we're never going to be able to diagnose all of them, but the smaller fraction of them that we diagnose, that means the more that are undiagnosed and more people who may spread this because they have their ignorance that they're infected. Our general stay-at-home order and stay away from people recommendations can help with that, but it certainly would be more helpful if we knew more about the people who have the infection. So it is clearly harming our efforts to do the work of public health.
Dr. Farley or Brian, do you know what it is you need in terms of PPE specifically and ventilators? Some of that material apparently could be coming from the federal government. Do you know what it is you need in terms of numbers?
I can't give you specific numbers. I know that we need a lot because there are many healthcare workers in the city and many interactions. We need masks. We need face shields. As far as ventilators, we have raw data right now about how many ventilators are in the city. We haven't compiled it yet, and we don't have good projections as to how many we would need, but it's fair to say that we want to have plenty, and we want to slow this epidemic wave so that we have enough when it gets at its worst.
I have a healthcare worker who's told me that she is keeping a mask on her face for a 12-hour shift. One mask, it's what she's allotted, and that she may be seeing as many as 30 patients as a minimum and far more as a maximum using that one face mask. Is that safe for her, Dr. Farley?
You know, if we had an unlimited number of masks, they would change their mask after every patient interaction. We don't, and so under those resource-constrained conditions, we made recommendations on how to conserve masks. And conserving masks, our recommendations are you can use it for an entire shift. That's not ideal, however, it is pretty safe. It is not as safe as we'd like it to be. That's simply what we're left with given the situation we're under.
Can Brian quickly tell us how many police officers or firefighters are off the job because they possibly were exposed or actually have tested positive for the virus?
No. At this point in time, we're not aware of a significant number who are self-quarantining or and we are not going to confirm the occupations of anyone who tests positive.
Thank you.
Okay, next up we have Sean Walsh with the Inquirer.
Thanks very much. First question is, we're hearing about Airbnb parties and other gatherings in private residences that are still occurring. Those were not, as far as I understand it, part of the stay-at-home order. It was about outdoor gatherings. Is there anything the city can do or is planning to do about gatherings in private homes?
I think we have continued to encourage those. Large parties are certainly have been prohibited under our order. We will be addressing those as they come up. We have also been told about issues with Airbnb, and we're reviewing that now. That issue came up this morning, and it's something that we are actively looking into.
And could you talk about that? What might you be able to do about Airbnb?
Sean, I literally got the issue an hour ago. I am trying to work through it, and so certainly as we have more information, we can let you know.
With services like DHS that involve going to people's homes, city workers, doing home visits and things like that, can you talk about how that's being handled? Can people refuse visits into their homes? Has there been disruptions in any of those services?
Yeah, we'll have to get back to you with more details, and we'll make sure that our Deputy Mayor for Children and Families are made available for that conversation.
And for any of the city services that aren't directly related to the coronavirus, but you guys are keeping going, has there been, just because of the difficulty of the situation, like a curtailment of service or an inability to provide it?
Certainly, we've had some services that are strained. We've had delays in providing service, but to my knowledge, we haven't had the inability to provide any service. Again, there's been some delays, there's been some slowdowns, but every service that we have deemed essential has been able to be delivered at this point.
And I just want to take a moment to again thank all of our city employees who are out there in the field, police officers, firefighters, paramedics, social workers, people dealing with the homeless. They are certainly champions for our city, and they deserve all the respect and admiration that we can muster for them. And it's remarkable to watch dedicated public servants go and do their job every day and put themselves in harm's way potentially, and we thank them for it.
Thanks. And lastly, for the quarantine sites, can you describe a bit more what you guys will do with folks who are diagnosed at a clinic but don't want to go to a quarantine site, and then there's a follow-up for once they're there?
Sure. So we are looking at our legal options about what for those who refuse care and service. We do believe that we have options to make sure that they get care to make sure that this disease does not continue to spread. I think we are working with our law department to make sure that those issues are well in hand. So we're fairly confident that we're going to be able to work through that issue in the next day or so.
Does that mean that they could be forced to go against their will?
You know, I certainly hope we don't have to get there, but in some cases, if it's to stop the spread of the disease, yes, we may end up getting to that point.
And then just the last related question to that is if they are there and they're experiencing addiction and withdrawal dangers are a concern, including to their health, you know, how would you handle that?
Again, we'll have wraparound services at all of our quarantine sites to make sure that services are provided, and anyone with severe mental illness or addiction services are continued to be provided to make sure that those issues are addressed. I do just want to address one thing. You know, I know in Eva's talking points, we weren't confirming the location. I did confirm with our elected officials before this press conference that the Holiday Inn is, we do have an active lease with the Holiday Inn in Center City. Again, appreciate their leadership and forethought in partnering with the city on these important issues.
Thank you.
Okay, next we have Mike D'Onofrio with the Tribune. You're unmuted now.
Hey, I just had one question. Yesterday you offered to push back property taxes and other taxes yesterday, but right, and legal evictions now, you know, can't take place. But, you know, what are you offering any solutions for renters? I mean, what is for either Abernathy or the mayor, you know, what is your message to landlords as the end of the month, you know, quickly comes to a close?
My advice or ask to landlords, to owners of shuttered hospitals, to those people who can provide opportunity for us to help people is to be mature, be responsible, be a good citizen, and try to do your best to get us all through this situation. That's all we can do. I mean, human nature is what it is. People will take advantage. We have people hoarding things and trying to sell them at a higher price. And we have, you know, the owner of the Hahnemann Hospital jacking up monthly prices. People will take advantage of, trying to make a buck out of this. And I think that, again, is sad. Hopefully the vast majority of people in our city, whether they're landlords or anyone else, will understand this is probably the biggest health crisis in our generation, and they should act accordingly. But we can only take this stuff case by case, and we have enough opportunities for people to call and complain so we can investigate and get done what we need to get done. We need people to step up, be mature, be adults, and be responsible.
Thank you.
I just wanted to add that before this, as you had seen in the mayor's budget address, we were looking at standing up quite a substantial rental assistance program for people with great needs, and hopefully we'll be able to continue with those plans. In addition, we have advocated at the state and federal level for rental assistance programs that can support both the tenants and the landlords who need the income. So we hope that that will go forward.
Thank you. Next, we have Nick Kepler with the Washington Post.
Thank you. Can you hear me all right?
Yeah. Hi, Nick.
Okay, great. Well, I wanted to ask some additional questions about possible places where hospital beds could be placed. I was wondering if we could go over some of the negotiations about Hahnemann Hospital. How much money was the owner initially asking for when he wanted the city to buy it? And then how much money was he asking for when he wanted the city to rent it?
You know, I'm not going to get into the tit for tat negotiation in public. I need to be able to negotiate with the owner to the best of my ability. And I don't think that is helpful to do through the press. And we certainly can get back to you on where we end up at the end of these negotiations. But I will say that selling the property for what he considers fair market value was well outside of our ability to pay.
Are there any other sites that are closed that you're looking to reopen or repurpose?
We are looking at a number of sites throughout the city on whether those could be some hotels, additional hotel sites, whether former dormitory style, not dorms for on college campuses, but dormitory style living arrangements. So we are looking at a number of sites throughout the city for additional quarantine and quarantine space. And certainly as those come online, we'll have additional updates, but we are in negotiations with other owners.
And just so I understand what is, I mean, there's not much that's normal right now, but just so I understand what might be considered normal. I mean, you mentioned you had a lease with the Holiday Inn. Could you explain that details? I mean, are they donating that space? Are they giving it to a cost?
No, we negotiated a lease and a cost with the owner of the property. And again, I'm not going to get into the details of that lease at this point, but we will be staffing that through a third-party property manager who will then sublease a number of functions to make sure that the hotel continues to be able to provide services. And we'll also be bringing in outside third-party social service providers for wraparound services.
Okay. Thank you.
Next up is Martin Pratt. You've been unmuted.
Hi, this question is for Bryant. The nursing home, I guess what you call it, rule of no visitors, is that going to go past the April 3rd or March 27th?
Yeah, that came from the health department. That's open-ended. We don't have a deadline for that. We're going to have to see how this epidemic unfolds.
Well, can you say, another follow-up question to that is, have any workers been infected by the coronavirus, or how are you, I guess my question is, how are you adjusting the date to that? Because a lot of our seniors and their families have contacted us and saying, when is this when can I see my grandmother? When can I see my auntie and folks like that? So is there some rule that you're judging the date by?
We know in this epidemic that the most vulnerable people are elderly people in nursing homes. Where we reported the other day that we did have our first case in someone in a nursing home. That's something that concerns us a lot. We do not want to see deaths in nursing homes. So with our current status and with the epidemic getting worse every day, we're simply saying no visitors to nursing homes. These are the people who are probably most likely to bring the infection in and to pass the infection on to residents. So I'm going to say we're simply going to have that rule until we feel like it's safe for nursing home residents. I understand that that's difficult for families. They want to stay in touch. This is a time for people to learn how to stay in touch by telephone or by video chat, not to go and visit their loved ones because they could be causing an infection that could really hurt everyone in that nursing home if they do that.
Okay, thank you.
Okay, next we have Laura McChrystal with the Inquirer.
Hi, I'm wondering if you could tell us whether anyone in the city jail has been diagnosed?
No, there has been no cases within the Philadelphia Department of Prisons.
Okay. And Dr. Farley, you mentioned how many people had been tested at the site at the stadiums. Could you give us any information on how many of those people tested positive versus negative? Have results come back yet?
I don't have the results broken down by the site in which the data was collected. I can see if we can bring that back to you tomorrow.
Okay. And another question, the Medical Reserve Corps, how many volunteers have signed up? Do they still need people for that to continue signing up?
Thanks for asking about that. For those who don't know, the Medical Reserve Corps is an organization of people that includes medical workers and non-medically trained workers who volunteer to help out in crises like this. I don't have specific numbers, but I can tell you that we've been calling for volunteers to help out, and we have seen a surge in the number of people who have gone to our website and volunteered. So if future people want to volunteer, www.phila.gov/MRC, and I'll get back to you on the numbers, but it's gratifying to see the response we're getting.
Okay, if I could, a quick follow-up on that, what kind of volunteer activities have those people who have signed up are they being used for?
Right now they're working at the Citizens Bank Park testing site. In the future they may be employed in a variety of different roles.
Thank you.
Great, next is Marco Serino. with PLS.
Good afternoon. My first question is for, I guess, Brian Abernathy. Perhaps the mayor can join on this here. When Hahnemann first closed in the summer, there was a lot offered by the city and the state in terms of deferring debt. I'm just curious what conversations have gone on with the state regarding attempting to reopen Hahnemann and potentially trying to use that debt refinancing as any sort of leverage.
My understanding is all of that was wrapped up into the bankruptcy court, and this is really, at this point, a real estate transaction.
Okay, thanks. Thanks for the update there. I guess second question would be for, again, for Brian. With the deadline on tax filings pushed back to July, I guess the mayor can answer this too. How is that affecting the projections on the budget and what should be starting soon in terms of budget hearings?
Again, this is an unprecedented situation, and we don't have those numbers. We have some projections that finance folks and revenue folks are doing, but we won't know the exact situation until we begin to come out of this. Understand how much that we've spent, that we weren't scheduled to spend, where our revenues are or not, and we will have a better idea a little further on through this process when we see how much we have to spend in order to address the pandemic.
Okay, to quickly follow up, is there a deadline or any sort of financial threshold that creates sort of that forces the hand or creates some sort of just, worst case scenario right now, or have we not approached that bridge?
There are many scenarios that our finance folks are entering the process of trying to do those scenarios. I don't have that information right now, but if I had it, I wouldn't throw it out there because it would create, all kinds of speculation that we don't need. When we have the numbers and we know they're secure, and we know what the revenue numbers are, and we know they're secure, then we'll adjust the budget accordingly. But to have this kind of what-if conversation right now doesn't serve the process and doesn't serve the citizens of the city.
Okay, thank you.
Okay, next we have Max Marin at Billy Penn, WHYY.
Hi, everybody. Thank you for being here. First question is for Brian or the mayor. I know we're only 2 days into the shelter-in-place order, but I just wanted to know what the word is from the police department about enforcement, any challenges in terms of getting people to go indoors, especially in higher traffic areas where people are just not social distancing right now.
So first, it's a stay-at-home order, not a shelter-in-place order. Just want to make that very clear. And right now, I think the police department is handling it well. They are responding to calls appropriately, and certainly most folks have voluntarily followed their advice when engaged.
When you look at places like China, which are authoritarian government and society, we are a democracy. And I know that can be messy sometimes, but we're doing our best with using common sense and engaging people. It's not going to be 100% perfect, and there are going to be people who continue to just kind of flaunt it and think that they know better. And we have the President of the United States who's saying maybe we're going to get rid of these restrictions. That doesn't help the situation. And we'll continue to engage with the police and through public information that this is dangerous, perhaps not as much for you who's violating the order, but for older people and others in the community who are more susceptible to the disease. We have to be less selfish. We have to be more unselfish about this situation. This is, again, I said, the greatest public health crisis in our generation. And if that's not enough for you, then I don't know what to do. But we will continue to engage with them and with our police and others and people in the government and try to get people to use their common sense and stay the hell home.
Just one more question, I guess, for the mayor while I have you. I understand that you have not been tested for the coronavirus, but just considering the reports about the governor yesterday and his possible exposure, are you concerned at all about yourself and members of the senior administration risking exposure?
Sure.
And what is the testing policy for?
Right now, I'm nice and cool. I don't have a cough other than my sinus, other than my allergy. So I have no plans on getting tested, and it would be a waste of the test on myself at this moment because other people need those tests. If in fact I stay free of that. Then I won't be tested. If I have symptoms, I will consult with my physician and take my physician's advice on what I should do.
All right, thank you, Mr. Mayor.
All right, Jake Bloomgard is up next.
Hi, all. So there was some comment made about aid for renters. I was curious if that referred to the program that was unveiled in January, that was the kind of aid to the owners of low-income housing tax credit homes, or if that was the thing that was kind of announced at the budget address a couple weeks ago, which was going to be more of the kind of cash aid to renters. And both those programs were kind of small. I was wondering if there were plans to kind of expand them.
This was, I think Eva's reference was specifically towards what was announced in the budget address. I think, look, yes, it's a relatively small program, just like our commercial lending program that was announced yesterday. The need is huge. We know the need is huge, and we're going to need to do more, and we're going to need our federal government to step up and for Congress to actually vote on an aid package. We're not going to be able to do this all by ourselves. There is no doubt. And we need our state and we need our federal government to step in and help provide support to the people who most need it and stop arguing over petty politics.
Right. Okay, a couple more questions for you. I'm curious about how the quarantine side is going to work exactly, because, not just for the homeless, but also for people who can't shelter at home. What does that mean exactly? If I was living with a partner and they came down with it, would that mean that they would go there or would be able to go there? Or are we more talking about like victims of domestic violence and such?
We would, in most cases, we would advise folks to quarantine at home with their families. There are going to be circumstances where that's not feasible for one reason or another. If someone has a compromised immune system at home, if for victims of domestic abuse, I think there's a host of, and I can't even, frankly, probably can't even list all of the potentials of where quarantine not at home may be required, and so those individuals would be able to quarantine at this facility, and it would be like a hotel room. You would check in. We would ask you not to leave for 14 days. Food would be brought to you, and any services that you would need would be provided on site.
Got it. Okay. This next question kind of, I think, is going to be a very similar answer to the rent question or to the rent aid question. But, obviously SEPTA is facing some serious financial headwinds. Is the city in any position to support SEPTA financially at all? And then if not, what kind of can the city do to support SEPTA?
I mean, look, we've tried over the last 4 years to do innovative things in education and job training and all kinds of stuff that we wanted to do to lift our folks out of poverty. This whacked us in the back of the head, as it has in other cities, to the point where a lot of those plans and programs are now up in the air. We're going to do our best to provide whatever resources we can reasonably without bankrupting the city and setting us back again, back to the bad old days of fiscal crises. But it's a tightrope walk. We cannot, as Brian said, cannot do this by ourselves. The federal government needs to get its act together and vote on something substantial. And we're supporting SEPTA's request for federal help. I don't know what the future brings until we see how far this goes, how long it lasts, what the numbers are, and then we'll adjust the best we can. But it's very frustrating when you think about all the things that we were planning on doing in the second term and what we've done in the first term, and some of that's is in jeopardy now because of this situation. Now, this situation has been put upon us and put upon the country and the world, and we're going to do what we can to make sure that we address it in the most effective way possible. But we don't, unlike the federal government, we don't print money, and maybe it's good we don't, but. We're doing our best every single day. We're looking at the numbers we're looking at everything every day to try to address the thing. So speculating, even 2 days, a week from now, 2 weeks from now, a month from now is impossible.
Got it. Last thing, the eviction ban. I know when the courts first unveiled that, it was only for a couple of weeks. I assume that's just going to be continuing for the foreseeable future now.
So right now, I think they are closed until April 6th, given the Supreme Court. Clearly, this is in the Supreme Court's purview on how long that closure lasts. But given the city's posture and our expectations for the length of time that these actions are going to be necessary, I wouldn't be surprised if that was extended at some point. But I can't speak for the Supreme Court.
Of course. Okay, that's what I got. Thank you.
Okay, we have about 3 reporters left, and then we will see if we have time for a second round, but we are running up against time. All right, Impacto, if you would just identify yourself. We don't have a name here.
Perla? Yes, can I speak?
Can you speak up?
Yes, Perla.
Carla, okay, go ahead.
Perla. Okay. Es una pregunta en español porque sé que me están escuchando otros periodistas y activistas que hablan solamente español. Y bueno, quiero saber el mensaje de la alcaldía de Filadelfia, del alcalde de Filadelfia para la comunidad inmigrante, en especial para aquellos que son indocumentados, muchos de ellos que trabajan en los restaurantes que han sido ya despedidos, muchos de ellos que viven solos en esta ciudad, muchos de ellos que no tienen o que son comerciantes y que no tienen acceso a ningún tipo de ayuda.
Okay, so the question is, what is the message from the city for those workers who are immigrants, who are undocumented, who may not feel that they are being supported, that there are no safety net for them, that they feel that they're losing their jobs and that they don't have that many resources?
You want to stay here?
Oh, that's right, I have to translate that.
As you know, we're a welcoming city. We don't require people to identify their document status when it comes to serving people. If you're an immigrant, look, I understand the issue of unemployment, and that's concerning and scary for people. But we're going to do our best to get the resources that we have available to us to them without consideration of their documented status. Of all the cities of most of the cities in the country, if you're undocumented and you're here, you're safe and you're supported. And as we'll deal with this on a case-by-case basis, it's hard to get people these days to come forward, and it's understandably so because they're concerned about federal policies on immigration and ICE and all the other things we've been dealing with. But we will do our best to serve every citizen and every resident of our city the best we can.
La ciudad de Filadelfia es una ciudad que recibe a todos, todos son bienvenidos acá, todos y todas son bienvenidos. Todos los servicios que estamos poniendo a disposición debido a esta crisis es para todos y para todas, no importa si tienen documentos o cuál es tu estatus migratorio. Nosotros entendemos que la gente tiene mucho miedo, sobre todo por las políticas que el gobierno federal ha estado usando y por ICE. Pero acá en Filadelfia todo lo que estamos poniendo todo lo que estamos haciendo para ayudar a las personas incluye a todos, no solamente a ciudadanos, sino también a gente que vive acá, que de repente no tiene documentos. Y todos los servicios de los cuales se ha hablado no se va a pedir ninguna muestra de estatus migratorio.
Gracias, agradecer a nombre de la comunidad que habla español solamente lo que está haciendo exactamente ahorita, haciendo también esta conferencia para los de lengua hispana.
She just said thank you so much in the name of the Spanish community.
De nada.
Okay, next up we have Nina Feldman with WHYY.
Hi, can you hear me?
Hi, Nina.
Hi. Quick question for Dr. Farley. There have been a lot of reports across the country of hospital systems in financial trouble right now because of the cancellation of elective surgeries. Have you heard that from local health systems? And if so, how bad is it?
I've not heard that from local health systems, but I don't necessarily deal with the financial people. I deal with the medical hierarchy and the chief medical officers. So we haven't heard that yet.
Okay, yeah, there have just been reports of it being so dire that, closures and massive layoffs would be imminent if there weren't some sort of federal mass relief. So seems like you would have heard about it if it was.
If we were at
bad.
that stage, I believe I would have heard about it, yes.
Okay, thanks. That's it.
You know, in a national crisis like a war or depression, it's incumbent upon the national government to take care of the country. We're doing what we can do here. The governor in Pennsylvania is doing what he can do there. But this is a need for the President of the United States and the United States Congress to step up and act like it is a war, act like it is a depression, and do what needs to be done. We need a little bit of Franklin Roosevelt to be, as a matter of fact, to be involved in bringing our country back. And they have the resources to do it, and arguing about little odds and ends here and there is not helping anybody on the ground in Philadelphia or New York or Chicago or anywhere else. And I just hope that they get themselves together soon.
Okay, thank you. Denise Clay is up next.
Yes, good afternoon, everybody. Mr. Mayor, you mentioned at the beginning of the press conference that no matter what Washington decides to do about staying, about the distancing regulations, that the city is going to...
Denise, can you please mute what you have going on in the background? It's very hard to hear you.
Sorry, because unfortunately I'm in a room where I'm not by myself. Hold on a second, please.
Blackboard folder. I'm going to be,
Can you hear me better now?
Yes.
Okay. You mentioned at the beginning of the press conference that no matter what the federal government decides to do about the distancing regulations, that the city is going to stick to its plan, what it's doing now. Have you also talked to the governor about that? And is that something that the state and the city are on the same page about? Well,
I just read on my device that the president is talking about relaxing these restrictions somewhere around Easter. I mean, I have no idea what he's talking about, but I'm going to listen to Dr. Farley. I'm going to listen to the medical community in Philadelphia and the region, and we're going to do what they say we should do because they're the experts, and we're going to keep our people as safe as possible and not follow down a road that the president seems to be leading everyone on, that somehow this is going to magically go away. It's not magically going to go away. We know from the science and the data how it's going to play out and where it's going to go, and we're going to follow their instructions because they're the experts, not the president.
Okay, thank you.
Okay, now we have Andrew Geller. You're now unmuted.
Hi, hello, Andrew Geller from Public Herald. Thank you for holding these daily briefings.
Yes.
We heard from HHS earlier that all evictions are illegal. This question is for the mayor. Why is the city of Philadelphia evicting homeless encampments in Center City right now, specifically around the convention center?
Because despite the fact that these folks need help, and we're trying to get assessments for them as to what is specifically how we can address their issues. We believe that if we can interact with them, whether it's addiction or whether it's mental illness or any other malady they may have, we have a better chance of addressing their problems direct and perhaps getting them on a path away from homelessness as opposed to allowing them to lay in the street.
Okay, a couple of quick follow-up questions. Were these forceful evictions? I heard about a report of an arrest. Is there an update?
There were no arrests. This was a planned action that had been in the works for months. There were notices provided to all the individuals who were there. The outreach went out for 3 months prior. 3 months prior to the action, and we were able to place the majority of those folks into appropriate services. This was really about how do we best wrap our arms around those who are most vulnerable, and make sure that they are provided services, provided beds, and provided long-term what we hope will be long-term support. this was not about the homeless individuals. This was, or removing an encampment in the middle of the crisis. This was something that was, again, long-term planned. We did a significant outreach, and we have a process that has been well served in Kensington and other parts of the city that we followed.
Two more follow-up questions. Was this eviction, did this go against the guidance of the CDC as far as people experiencing homelessness?
The CDC said that, as far as the COVID-19 goes, people might be safer sleeping outside. What it didn't address was all the other health insecurities that sleeping outside causes. The dangers, being out in the cold, the food insecurity, housing insecurity, all of those things that create challenges for our homeless population. And so while the CDC may have made broad, sweeping recommendations, they certainly didn't take into account all the issues that have faced our homeless population, and it's something that we are desperately trying to do as having some of the smallest on-street homeless population in the country.
So if people are depending on each other on the street, no matter what, would the city commit to a moratorium on further evictions of the homeless population?
I'm not sure I would use the word eviction, and so I'm not quite sure. This was about providing services to individuals and asking and removing some tents, but it was not about eviction or telling folks that they weren't welcome. I certainly understand advocates' concerns, but I think our workers, our outreach, are some of the most caring individuals that I've ever met, and I'm proud of the work that they've done. I'm proud of the services they've provided, and it's exactly the reason that we set up quarantine facilities. It's exactly the reason we'll be contracting for additional shelter space. We are not abandoning our homeless population, not in this instance or in any future instance. We have earned a reputation of being compassionate, and we're going to continue to maintain that reputation because these are all our brothers and sisters and mothers and fathers, just like everybody else, and we're going to continue to wrap our arms around them.
Thank you. One last question. There's a report of the Javits Convention Center in New York opening up as a makeshift hospital or shelter for at least, I think it's like 1,000 beds. Is there any plans in the works for the Pennsylvania Convention Center to do something similar?
We are having conversations with multiple sites about a potential surge capacity for hospital beds.
Great, thank you very much.
Okay, we have our final question before we move into our Spanish portion. Mike D'Onofrio.
Hey, thanks for letting me have one more question here. So I wanted to clarify something. In response to a question about looking for more hospital beds and quarantine spaces in the city, Brian, you said the city has hammered out a lease with the Holiday Inn, and so maybe I missed something. But can you tell me what this Holiday Inn site will be? Is this the quarantine site identified in news reports being based in Center City? How many beds will it have? When will it open?
Yeah, Mike, and I appreciate that, but I feel like I've addressed that pretty clearly in prior questions. We do intend to use this for quarantine space and to provide wraparound services for folks who couldn't quarantine at home.
All right, thanks.
Yep.
Okay, I'm going to ask my colleague Irene to make an announcement, and then we will move forward with the Spanish Q&A portion.
Hola, buenas tardes a todos los colegas de los medios de habla hispana. Nuestra porción de preguntas y respuestas está a punto de comenzar. Les recordamos que cada medio tiene 3 preguntas disponibles. Gracias.
Okay. All right, Brian Mendoza with NBC 10 Telemundo.
Hola, muy buenas tardes, Azucena. Tengo preguntas aquí. La primera es, ¿se está haciendo algo específicamente para inmigrantes documentados de la ciudad que han perdido su trabajo y que no pueden aplicar para desempleo?
Voy a interpretar esa pregunta. The question is there any initiative specifically for undocumented? Is there any initiative specific for undocumented residents who may have lost their job?
I mean, there is no specific program specifically for them. As we encounter folks in that situation, we'll do our best to help them and to refer them. There are entities that are hiring. We've seen some of the delivery services and some of the large takeout restaurants are hiring, and we'll be happy to give them that information, and hopefully they can find a job there. But there's no specifically tailored program at this moment relative to reemployment, and we're just trying to get our arms around the disease, around the virus at this moment.
Actualmente no hay una iniciativa específica para gente que no tiene documentos que haya perdido su trabajo. Estamos tratando de manejar la crisis y de hacer iniciativas que impliquen para todos, que sean para todos y para todas.
La próxima pregunta es, en cuanto a la falta de camas que se está hablando, ¿qué es lo que se está haciendo? ¿Están buscando otros establecimientos vacantes para que tal vez se puedan convertir en un sitio de hospitales para asistir a estos pacientes?
¿Te refieres a camas de hospitales, a la falta de camas de hospitales?
Sí.
Yeah. So this is a question probably for Tom. He's asking if there's not going to be enough hospital beds, of healthcare beds. What are we doing about that?
Talking to translate, but there's a number of steps we're taking to try to make sure that there are enough hospital beds for people to use. One of them is the social distancing we're doing now. That'll reduce the size of the peak of the epidemic wave that's coming up, so reduce the need. The other is that hospitals are looking at adding beds within their existing facilities. And the third is what Brian talked about earlier, looking at the potential for additional beds in other facilities in case even that is not enough for the beds that we need.
Hay tres iniciativas, tres formas que estamos intentando, tres cosas que estamos intentando hacer. Lo primero es mantener la distancia social para que la gente no se enferme, entonces no se necesiten esas camas. Lo segundo es trabajar con hospitales para que ellos empiecen a agregar más camas, tengan una capacidad mayor. Y lo tercero es lo que se ha mencionado, que es buscar sitios en los que puedan servir para cuarentena o aislamiento, para expandir esa capacidad.
Listo. Y la última pregunta, confirmaron que el Holiday Inn Express en el centro de la ciudad va a ser un tipo de establecimiento para mantener en cuarentena a las personas que no tienen hogares. ¿Pueden hablar un poco más del proceso cómo va a realizarse?
Okay. So he said that it has been confirmed that the Holiday Inn is going to be on quarantine site. He wants to know a little more about the process or the protocol of how people are going to go there.
We are working through final protocols but it will be in consultation with the individual's physician, as well as the ability for the individual to quarantine at home. And so those final protocols are a work in progress, as is the final staffing of the site.
Todavía se está trabajando en qué protocolos se van a utilizar. Por ahora lo que estamos viendo como posibilidades es que un médico haga la decisión sobre si esa persona necesita estar en cuarentena o no. Y también tenemos que ver si existe la posibilidad de que esta persona esté en cuarentena en su propio hogar para así no tener que llevarlos hacia allá. Entonces eso todavía se está decidiendo. Ahorita no hay un protocolo definido.
Y se habló acerca de usar la ley, si es que porque se habló que esto específicamente va a ser para personas sin hogares. ¿Puede explicar un poquito más si es que se va a tener que usar la ley en cuanto a personas que no quieran atender a este sitio?
Yeah. So the question is, are we going to use any kind of law to force people who don't want to go into quarantine?
We are reviewing that with our law department, but feel confident that those who are refusing care, that we can likely require that they receive care.
Estamos revisándolo con el departamento legal. Nuestra esperanza es que aquellos que no quieran o que no quieran el cuidado, que de alguna forma podamos realmente llevarlos y hacer que reciban lo que necesiten.
Gracias.
Okay. Okay, our last question is from Carmen with Philly Cam. You are now unmuted.
Hola a toda la comunidad latina que nos está escuchando. Estoy muy preocupada por la comunidad migrante indocumentada porque no hay ningún apoyo ni de la ciudad, ni federal, ni estatal. Y es la gente que pierde sus trabajos y que es la fuerza más grande económica en nuestra ciudad. ¿Qué tipo de apoyo se está manejando, pensando para ellos?
So she's concerned about the undocumented communities that are losing their job or their income capacity and that are one of the biggest forces in the community. So they want to know what are we doing about it.
We do not have we don't have a program specifically for undocumented folks. We want to treat all of us the same. We will do our best to refer people for employment, to put out the areas or places where people are hiring, and we're going to do our best to serve everyone equally, both citizens and residents alike, documented or undocumented. And there's no specific program, but we consider everyone Philadelphians, and we will work together to get everybody where they need to be.
No hay ninguna iniciativa específica, pero nosotros consideramos que todos los filadelfianos, todos los que viven en Filadelfia son iguales y merecen el mismo tipo de servicios, no importa si tienen documentos o no.
Thank you all.
Thank you.
Thank you.
Thank you.
Gracias.